Each year, at least 500,000 babies are born prematurely in this country. Now, as health and medical correspondent Sara Lee Kessler reports, a new study shows a link between the length of time it takes to get pregnant and a woman's risk of delivering early.
Say hello.
Kimberly Smarecki is smitten with her month-old baby, but she hasn't had much of a chance to show him off. Peter is still hospitalized after arriving 9 weeks early, weighing less than 3.5 pounds.
You know, there was no way of me really knowing that it was going to happen. You know, you don't think it's going to happen. You think it's going to be full term, and, you know, when it's time to go, it's time to go. And not with him, he wasn't waiting.
The reasons for premature birth are a mystery in nearly half the cases. But a study of 56,000 Danish babies published in the journal Human Reproduction shows that women who took more than a year to get pregnant had a higher risk of delivering a premature baby.
The conclusions were that significant portions of patients that had phases of infertility, periods of infertility, were more predisposed to have premature deliveries.
Once adjustments were made for factors that are known to influence premature births, such as age, smoking, drugs, and alcohol, the study found that women who had trouble getting pregnant were 40% more likely to deliver a baby early.
Feet there. In the feet?
Mm-hmm. That's very cool.
Very cool.
Dr. Manuel Alvarez, an infertility specialist at Hackensack University Medical Center, is not surprised by the findings of the study.
Women that are undergoing infertility treatments, I think the stress of that scenario is, in my opinion, a main factor for the high rates of preterm labor that they found.
Premature labor can also be triggered by such medical problems as high blood pressure, infections, or bleeding.
I was a gestational diabetic, so I know that has something to do with it.
More and more research is focused in making the diagnosis before preterm labor happens. Transvaginal ultrasound now, we use that very commonly to look at the length of the cervix in an ongoing pregnancy to see if the cervix, which is the opening of the womb, is being reduced in size.
That's the goal, to keep the baby in place for a full 40 weeks. For New Jersey Public Television, I'm Sara Lee Kessler.